Hello, this is Dr. David. Today I want to talk about toilet infection, a very common thing we hear in the clinic almost every day. See, some people say, Doctor, can you prescribe to me a drug? I visited a bad toilet and now I'm having itch, now I'm having discharge. Please get me a drug. Some say, I'm having low abdominal pain, I'm having painful urination, I visited a very bad toilet and now I'm having these problems. So today we'll talk about it. How do you feel when I tell you that medically speaking, there's nothing really like toilet infection? Yes, nothing like toilet infection. When you have those symptoms, itching, discharge, low abdominal pain during sex, it could be because of a myriad of causes, none of them really the toilet. So what could cause it? What could have been the reason why you're having those symptoms? One, and very common, is the yeast infection. We call it candidiasis. We have the vaginal vaginosis. We have urinary tract infection caused by a myriad of bacteria. We have sexual transmitted infections. And so those are the things that actually do cause the toilet infection. And the one that is quite related to the toilet is actually a toilet habit infection, and we'll talk about it. So let's get in. So from the causes, we note that there are actually causes that are not really related to the toilet where you sat. The only one that is quite common related to the toilet where you toilet is the toilet habit. Women naturally will clean their toilet after using the toilet. They clean from the back to the front. It's usually easy to do like that. And sometimes they carry some particles that contains the normal bacteria that are found in the rectum, and they are now introduced into the vaginal tract, or sometimes even the urinary tract. So it eventually will lead to infections, itching, discharge related to the toilet, but most of the times is from the rectum that it came, not from the toilet where you sat. So when you go to the toilet, sometimes you see ladies, they will climb on top of the toilet seat in order to avoid toilet infection. That's funny. Really, that will not make you avoid toilet infection, because it's really not the toilet that would actually cause you to have toilet infection. So if you're having these symptoms, it means that when you see a doctor, he's going to run through these common causes and find out which one is the cause, and he will give you medications for it. If it is a yeast infection, most of the times antifungal drugs or antifungal creams or pessaries are given. If it is a vaginal vaginosis, antibiotics usually do well. Oxycycline do that well. If it is a UTI, most of the times a urine culture is needed, and most of the times the offending organism is found. Sometimes the Escherichia coli, sometimes you find other microorganisms. If it is the STI, many of them gonorrhea, syphilis, they are also treated after a culture, a high vaginal swab culture is done. So that's how you treat it. But the important question is, some people have this persistent vaginal discharge, and it's foul smelling, it's itching, and they feel it's normal. It's actually not really normal. I found out that for some women, they have really bad perineal habits. They don't handle their hygiene well. They don't use good panties, and they have this discharge. How do they treat it? They decide that, okay, since I'm having this discharge, I'm going to do something about it. So they wash inside their private parts of their vagina, how we call it here, private parts, very thoroughly with soap and water. Some people even use perfume there so that it will take away the discharge. You see, when you use soaps that are usually alkaline in nature, it distorts the normal physiology of the vagina, making you to have persistent lower genital tract symptoms. So what do? No douching, no washing of the vagina. When you're having this problem, you come to the hospital, we give you drugs. Most of the times when you follow this very simple tricks, you find out that vaginal discharge becomes a thing of the past. Thank you.